Chlamydia is one of the most common sexually transmitted infections, STIs, worldwide, caused by the bacterium Chlamydia trachomatis. It primarily affects the genital tract but can also infect other areas such as the rectum, throat, and eyes. Due to its often asymptomatic nature, many individuals remain unaware of their infection, leading to potential complications if left untreated. This article provides a detailed overview of chlamydia, including its causes, symptoms, transmission, diagnosis, treatment, and prevention. Causes and transmission. Chlamydia is caused by the Chlamydia trachomatis bacterium, which spreads primarily through sexual contact. The most common modes of transmission include unprotected sexual contact. Engaging in vaginal, anal, or oral sex with an infected partner increases the risk of transmission. Mother-to-child transmission. Pregnant women with chlamydia can pass the infection to their newborn during childbirth, potentially leading to neonatal conjunctivitis, eye infection, or pneumonia. Sharing contaminated sex toys. Using shared, unclean sex toys can transfer the bacteria from one person to another. Non-sexual transmission. Though rare, Chlamydia trachomatis can infect the eye through direct contact with infected genital secretions, leading to trachoma, a severe eye infection. Symptoms of chlamydia. One of the main reasons chlamydia is widespread is that it often presents no symptoms, especially in the early stages. When symptoms do appear, they typically manifest within 1 to 3 weeks after exposure. Symptoms in women. Abnormal vaginal discharge, yellow or milky white. Pain or burning sensation during urination. Lower abdominal pain or pelvic pain. Pain during sexual intercourse. Bleeding between periods or after sex. Cervicities, inflammation of the cervix. In severe cases, pelvic inflammatory disease, PID, which can lead to infertility. Symptoms in men. Painful urination. Unusual penile discharge, clear, white, or yellowish. Pain or swelling in the testicles, less common. Discomfort or burning sensation in the urethra. Rectal pain, discharge, or bleeding, in cases of anal infection. Symptoms in other areas. Rectal chlamydia, can cause rectal pain, discharge, and bleeding. Throat chlamydia, sore throat or mild irritation, often asymptomatic. Eye chlamydia, conjunctivitis, redness, swelling, and discharge from the eyes. Complications of untreated chlamydia. If left untreated, chlamydia can lead to serious health complications, including pelvic inflammatory disease, PID in women. Untreated chlamydia can spread to the uterus and fallopian tubes, causing PID, which may lead to chronic pain, ectopic pregnancy, and infertility. Epididymitis, in men, chlamydia can cause epididymitis, an inflammation of the coiled tube at the back of the testicles, leading to pain and swelling. Increased risk of HIV, having chlamydia increases susceptibility to HIV infection if exposed. Infertility, long-term infection without treatment can damage reproductive organs, leading to infertility in both men and women. Reactive arthritis, some individuals may develop reactive arthritis, a condition that affects the joints, eyes, and urethra. Diagnosis of chlamydia. Diagnosing chlamydia is relatively simple and involves urine test. A sample of urine is tested for the presence of Chlamydia trachomatis. Swab test. A swab is taken from the cervix, women, urethra, men, rectum, or throat for laboratory analysis. Healthcare professionals may recommend screening for sexually active individuals, especially those under 25 years old, pregnant women, or individuals with multiple sexual partners. Treatment for chlamydia. Chlamydia is easily treatable with antibiotics. The most commonly prescribed antibiotics include azithromycin, a single-dose antibiotic. Doxycycline, a 7-day course of antibiotics. Patients should complete the full course of medication even if symptoms disappear early. It is also recommended to abstain from sexual activity until treatment is completed and the infection has cleared. Partners should be tested and treated simultaneously to prevent reinfection. Prevention of chlamydia. The best way to prevent chlamydia is through safe sexual practices and regular testing. Key prevention strategies include using condoms. Using latex or polyurethane condoms correctly reduces the risk of transmission. Regular STI testing. Individuals with multiple partners should undergo regular chlamydia screening. Monogamous relationships. Being in a mutually monogamous relationship with an uninfected partner lowers the risk. Avoiding sharing sex toys. If shared, sex toys should be properly cleaned or covered with a new condom before use. Educating sexual partners. Open communication and education about STIs help prevent infections. Prenatal screening. Pregnant women should be screened to prevent transmission to newborns. Conclusion. Chlamydia is a highly common but preventable and treatable sexually transmitted infection. Due to its frequently asymptomatic nature, routine testing is crucial in identifying and treating the disease before complications arise. With proper antibiotic treatment, chlamydia is curable, and preventive measures can significantly reduce the risk of infection. By raising awareness, practicing safe sex, and encouraging regular health check-ups, the spread of chlamydia can be controlled, ultimately leading to better sexual health outcomes for individuals and communities worldwide.
Thank you for watching. Please subscribe our channel.